Ear pain is one of the most uncomfortable and distressing sensations a human can experience. It can be sharp, stabbing, dull, throbbing, or burning. Sometimes it comes suddenly, sometimes it builds slowly over days. For some people, ear pain is mild and temporary. For others, it becomes unbearable, affecting sleep, concentration, work, and overall quality of life. But here is the real question. Why does ear pain happen? And more importantly, when is it harmless and when is it dangerous? In this video series, we will break down ear pain step by step in simple English so that anyone can understand it, whether you are a patient, a student, or just someone worried about their health. This is part 1, where we will cover what ear pain really is, how the ear works, different types of ear pain, why ear pain should never be ignored. By the end of this part, you will understand your ear better than ever before. Ear pain, medically known as otalgia, refers to any pain or discomfort felt in or around the ear. But here's something many people don't know. Not all ear pain actually comes from the ear. Yes, pain felt in the ear can originate from the ear itself, the throat, the teeth, the jaw joint, the neck, even nerve problems. This is why ear pain can be confusing and sometimes misleading. Doctors divide ear pain into 2 main types: primary otalgia, pain coming from the ear itself; referred otalgia, pain coming from somewhere else but felt in the ear. We'll explore both in detail later in this series. To understand ear pain, we must first understand how the ear is built. The human ear has 3 main parts. The outer ear. The outer ear includes the visible ear, pinna or auricle, the ear canal. Its main job is to collect sound, guide sound waves toward the eardrum. The skin of the ear canal is very sensitive, which is why small infections, scratches, wax blockage can cause significant pain. The middle ear is an air-filled space behind the eardrum. It contains 3 tiny bones, ossicles: malleus, incus, stapes. These bones amplify sound vibrations and send them to the inner ear. The middle ear is connected to the throat through the eustachian tube, which helps equalize pressure, drain fluids. Problems here are one of the most common causes of ear pain, especially in children. The inner ear contains the cochlea for hearing, the vestibular system for balance. Interestingly, inner ear problems usually cause dizziness or hearing loss, not pain. So if pain is present, the cause is often in the outer or middle ear, or from a nearby structure. Ear pain often feels worse than it looks. Why? Because the ear has many nerve endings, is located near critical nerves of the face and head, is enclosed in a small space with little room for swelling. Even slight inflammation can create intense pain and pressure. This is why children cry uncontrollably during ear infections. Adults describe ear pain as shooting, pulsating, or unbearable. Ear pain rarely comes alone. It is often accompanied by reduced hearing, ear fullness or pressure, ringing in the ear, tinnitus, fever, fluid or pus discharge, dizziness, headache. The combination of symptoms gives doctors clues about the real cause. Primary otalgia means the pain starts in the ear. The most common causes include outer ear infection, otitis externa, often called swimmer's ear. Causes: water trapped in ear, excessive ear cleaning, injuries from cotton buds. Symptoms: severe pain when touching the ear, redness and swelling, itching, discharge. This pain worsens when you pull the ear or press the tragus. Middle ear infection, otitis media, very common in children, people with colds or flu. Causes: blocked eustachian tube, bacterial or viral infections. Symptoms: deep throbbing pain, fever, hearing loss, crying in children, ear discharge of eardrum ruptures. This condition needs proper medical treatment. Earwax impaction, too much earwax can press against the eardrum, trap bacteria. Symptoms: dull pain, ear fullness, reduced hearing, sometimes dizziness. Never try to remove wax with sharp objects. Many people ignore ear pain thinking it will go away. It's nothing serious, but untreated ear problems can lead to permanent hearing loss, spread of infection to bone or brain, chronic ear disease, balance problems. Early attention can prevent lifelong damage. In this first part, we learned what ear pain really is, how the ear works, why ear pain can be severe, early warning signs. In part 2, we will go deeper into referred ear pain, jaw, dental, throat, and nerve causes, ear pain in adults versus children.
Part 2. Hidden and Referred Causes of Ear Pain. Introduction, Part 2. In Part 1, we explained what ear pain is, how the ear works, and the most common ear-related causes of pain. But here is something very important to understand. Not every ear pain comes from an ear problem. In fact, many people suffer from ear pain while their ears are completely healthy. So why does the pain feel like it is inside the ear? The answer lies in something called referred pain. In this part, we will uncover what referred ear pain is, why problems in the jaw, teeth, throat, and neck can cause ear pain, the difference between ear pain in adults and children, warning signs that should never be ignored. This knowledge can save you from unnecessary fear and also from dangerous neglect. What is referred ear pain? Referred ear pain means pain is felt in the ear, but the source is somewhere else. This happens because the ear shares nerve connections with many nearby structures, such as teeth, jaw joint, throat, tonsils, tongue, neck, face. The brain sometimes gets confused about where the pain is coming from. As a result, pain originating in the jaw or throat may be felt deeply inside the ear. This type of pain is very common in adults. Nerve connections of the ear. The ear is connected to several important nerves, including trigeminal nerve, facial nerve, glossopharyngeal nerve, vagus nerve. These nerves also supply teeth, jaw, throat, tonsils, tongue, neck muscles. Because of this shared nerve supply, pain signals can travel and overlap. That is why tooth pain can feel like ear pain, throat infections can cause ear discomfort, jaw problems can create sharp ear pain. Jaw joint disorder, TMJ, a major cause. One of the most common causes of ear pain in adults is temporomandibular joint disorder, also known as TMJ disorder. The TMJ is the joint that connects your jaw to your skull. It sits very close to the ear canal. Causes of TMJ disorder: teeth grinding, especially at night, stress and jaw clenching, misaligned teeth, arthritis, jaw injury. Symptoms: ear pain without infection, jaw pain or stiffness, clicking or popping sound when opening mouth, headache, facial pain. Many people visit ENT doctors for ear pain, but the real issue lies in the jaw. Dental problems causing ear pain. Dental issues are another hidden cause of ear pain. Common dental causes include tooth decay, infected tooth root, impacted wisdom teeth, gum infections. Pain from the lower teeth especially can radiate directly to the ear. Signs that ear pain may be dental: pain increases when chewing, sensitivity to hot or cold, bad breath, swollen gums. Ignoring dental infections can be dangerous, as infection may spread to deeper tissues. Throat and tonsil infections. Throat problems often cause ear pain without ear infection. Common causes: tonsillitis, pharyngitis, throat abscess, severe sore throat. Why does this happen? The throat and ear share the glossopharyngeal nerve, so when the throat becomes inflamed, pain is often felt in one or both ears. This is why people with tonsillitis often complain, "My ear hurts when I swallow." Sinus and nasal problems. Sinus infections and nasal congestion can also cause ear pain. When sinuses are blocked, pressure builds up, the eustachian tube becomes blocked, middle ear pressure changes. Symptoms include ear fullness, dull aching pain, facial pressure, blocked nose, headache. This type of pain often worsens during colds, flu, allergies. Neck and muscle-related ear pain. Muscle tension in the neck and shoulders can surprisingly cause ear pain. Causes include poor posture, long mobile phone usage, computer work, stress. Tight neck muscles irritate nearby nerves, which may refer pain to the ear. This pain is usually dull, aching, worse with neck movement. Ear pain in children versus adults. Ear pain behaves differently in children and adults. In children, most ear pain comes from middle ear infections, often associated with fever and crying. Children may pull their ears, usually follows cold or flu. In adults, referred pain is more common. Jaw, dental, and throat causes dominate. Less fever, pain may be chronic. This difference is crucial for correct diagnosis. Serious but rare causes. While rare, some serious conditions can cause ear pain: tumors of throat or tongue, severe nerve disorders, temporal arteritis in elderly. Warning signs include persistent pain for weeks, weight loss, difficulty swallowing, voice changes, blood and saliva. These symptoms require urgent medical attention. When ear pain is a warning sign: never ignore ear pain if it is accompanied by high fever, severe headache, neck stiffness, facial weakness, continuous discharge, hearing loss. These may indicate serious infection or nerve involvement. End of part 2. In this part we learned ear pain does not always come from the ear. Jaw, teeth, throat, and neck play a major role.
Ear pain, Otalgia, voiceover script. Part 3, treatment, home remedies, prevention, and when to see a doctor. Introduction Part 3, 00 to 130. In Part 1, we learned what ear pain is and how the ear works. In Part 2, we uncovered the hidden and referred causes of ear pain. Now comes the most important question: what should you do when your ear hurts? Should you wait? Should you use home remedies? Or should you immediately see a doctor? In this final part, we will clearly explain safe home remedies for ear pain, medical treatments used by doctors, what not to do, when ear pain becomes an emergency, how to prevent ear pain in the future. This information can protect your hearing and sometimes even your life. Immediate relief for ear pain, 130 to 700. When ear pain starts, people often panic. The pain can be intense and frightening. Here are safe first steps that can help reduce discomfort. 1. Rest and position. Lie with the painful ear facing upward. Avoid pressure on the affected ear. Keep the head slightly elevated. 2. Warm compress. Apply a warm, not hot cloth to the ear. Use for 10 to 15 minutes. Helps reduce muscle tension and pain. 3. Pain relief medication. Paracetamol or ibuprofen can help. Always follow proper dosage. Avoid aspirin in children. These steps provide relief, but do not cure the cause. Home remedies, what is safe and what is not. 700 to 1500. Many home remedies are popular, but not all are safe. Safe home practices. Warm compress, steam inhalation for sinus-related pain, adequate hydration, rest. Dangerous practices to avoid. Putting oil, garlic, or herbal liquids in the ear, using sharp objects or cotton buds, blowing air into the ear, ignoring persistent pain. Putting substances in the ear can worsen infection or damage the eardrum. Medical treatments for ear pain, 1500 to 2500. Doctors treat ear pain based on the cause, not just the symptom. 1. Outer ear infection. Antibiotic ear drops, pain-relieving drops, keeping the ear dry. 2. Middle ear infection. Pain relief medication, antibiotics if bacterial, monitoring in mild cases. 3. Earwax impaction. Professional wax removal, eardrops to soften wax. 4. TMJ-related pain. Jaw exercises, stress reduction, mouth guards, pain medication. 5. Dental causes. Dental treatment, infection control, tooth extraction or filling if needed. When to see a doctor immediately. 2500 to 3200. Ear pain should never be ignored if you experience